We're on all our fronts. Okay, wonderful. Happy Friday, everybody. It's May 20th, and it's very warm here in the DC area. Hope you all are all safe and well. And today we're going to talk about lower eyelid surgery. A couple months ago, we talked about lower eyelids in general, using me as a point of reference. So in terms of what we'll talk about today, we'll talk about the anatomy of the lower eyelids again, a little review, and what happens over time in terms of the aging process and what we don't like about the appearance of our lower eyes. I'll do a brief overview of the non-surgical options, including fillers and other injections, and we'll do an overview of surgery, how it goes, and what you can expect the recovery process to be like, and then I'll show you one of my lovely patients' before and after photos. Before we do that, a couple of announcements. You'll see here, you can text the word Tyndall to our office number, 703-705-2100, for your chance to win a skincare package valued at over $300. The word Tyndall, it comes from an effect that can happen when you place filler in the wrong manner under the eyelids. Okay, so in our wonderful gift bag, we have an exfoliant and a toner from PCA Skin. This is the exfoliant, nice and gentle, and the toner feels very fresh. Some of my staff are using it and loving it very much. A couple other products to enjoy: the PCA Vitamin B3 Brightening Serum. So for dark spots, areas that are affected by sunlight, sun damage, if you have a little too much pigment, this is a nice addition to your skincare regimen. And next is one of my favorites, vitamin C and E. So vitamin C and E both are antioxidant ingredients. It's great for your skin. The great thing about this bottle is that there is no water in this tube. And what that means is that the vitamin C is not activated. It's waiting to be activated when it hits the moisture of your skin or of the other skincare products you use. So great product, highly recommend it. And last but not least, summer's coming up, so you know you need some sunscreen. And we got one from Elta MD. This is the UV Clear. So this is nice, especially for people who have oily or skin or acne issues. It's a nice clear sunscreen to go on top of your skincare regimen. Again, this is a mineral sunscreen, a physical sunscreen. So your main ingredient is zinc, in this case 9% zinc. So it goes on a little bit cakey, but after you rub it in a little bit, it's very nice. And the SPF is 46, so unlike the skincare products that you get at the grocery or at Target, no knock on them, the SPF is exactly what it says it is. So if you buy Copper Tone or Banana Boat and it says SPF 50, it's not as rigorously tested, so you don't know if the SPF is exactly 50. But this SPF is 46, and they test it rigorously to make sure that the SPF is exactly 46. So again, please text the word Tyndall to our office number for your chance to win this wonderful skincare package in time for summer. All right, so here's my Q-tip. So the lower eyelids, let's go from superficial to deep, okay? You have the lower eyelid skin. It is some of the most delicate skin on your face, along with your upper eyelid skin. What can happen over time is that with all these expressions, including like closing your eyes, smiling, wrinkles can start to set in. The best way to help prevent those wrinkles over time is Botox every few months. Botox, for those of you who don't know, is a muscle relaxing injection that we perform in the office. It's one of the most common things I do. And in order to prevent the lower eyelid wrinkles from setting in due to these facial expressions, what you can do is put a tiny drop right under the lash line, and that can mute the wrinkling effect of the facial expressions that you carry. So that's skin, and then right under that is the eye closing muscle called the orbicularis muscle. This is a concentric muscle, so what it does is it closes your eyes really tightly like this, okay? Some people, actually one patient came to me earlier this week saying that she had a little bulge right here, right under the lash line, and that's not fat, that's actually orbicularis muscle, which you need to close your eyes. If this muscle is compromised to a point, what can happen is a very tough condition called ectropion, where your eye can go like this and your eyelid can be separated from the sclera or the white of your eye. So that's a very tough condition, and it results in a lot of dry eye, itchy eye, and it's a very tough condition to fix. So in order to avoid that, if somebody does have a little bit extra muscle bulk right here, I try not to offer surgery. Instead, get Botox injections to slim down the tone of the muscle and making the bulge less noticeable. Behind the muscle, there's a piece of saran wrap or membrane called the orbital septum. This is present in your lower eyelid as well as your upper eyelid, just under the orbicularis muscle. This is a tight membrane when you're first born, but over time what happens is that the fat pockets behind the orbital septum start to come forward. And this is one of those processes that you can't really prevent, and especially if baggy eyes kind of run in the family, you're more prone to it happening maybe earlier on in life, like in your 30s or 40s, or it happening more severely. So like I was mentioning, behind the orbital septum, you have the fat bags. So in the lower eyelids, you have 3 areas of fat bags. So one is the inner one, which is next to your nose, the middle one, and then the outer one, or lateral. So there are 3 areas of fat that can contribute to eye bags. Okay? Now, when you go from the eyelid bags and you go downward towards the border of your cheek, there's a ligament there, okay, and that ligament is attached from the superficial layers of the skin all the way down to your bone. So this is a boundary that your face naturally has, and in the medical terms we call it the orbito-malar ligament. So orbito is eye and malar is cheek. So the ligament is there between the eyelid and cheek. Now, this is often where people point to their shadow, or the dark circles under your eyes. You might see that in the mirror, or you might notice it on other people, especially if you've had poor sleep, if it's an allergy season, if you watch a sad Korean drama, things like that. So this area is something that we deal with along with the fat bags under the eyelids when it comes to surgery. Okay. So those are some of the anatomical features of this area, as well as what happens over time. Now, solutions that are not surgical often involve resurfacing of the skin or injections. Okay? So one of the nice ways to resurface this area and help kind of the crepey look that you can get over time with regard to the skin is a little laser resurfacing. And we have the laser resurfacing at the office, which you can do. We all have laser protection, and we provide you safety goggles or shields to protect your eyes from the energy of from the laser beam. And it feels like a rubber band snap, and it's in a sensitive area, so I would say the discomfort can be a 1 or 2 out of 10, but it's a relatively quick procedure. We recommend a cycle of 3 treatments, about 4 to 6 weeks apart. So the other thing that you can do at home without professional intervention is have a good eye cream, okay? And so that actually is a key factor in your skincare regimen. The eyelid skin is particularly thin and delicate, so you want to have different contents in your eye cream compared to your face cream. And just as a tangent, you want to have different contents in your neck cream compared to your face cream or your eye cream. So it may be a chore, but you want all 3, okay? Because the eyelid skin is particularly thin. The face skin is a little more resilient, but it also produces more oil. And the neck skin is a little bit on the thinner side, but it doesn't produce as much oil. So for those reasons, you should have 3 different creams. One for your eye, one for face, one for neck. Okay, now where were we? Back to non-surgical options for your eyelids, okay? When it comes to the shadow between the eye socket and the cheek, right here, the orbital malar ligament that I was referring to, one of the ways to blunt this shadow is to put something in it. You have two options here. One is filler, one is PRP, and actually, well, when we go to surgery, I'll explain the third option, it's fat. But in the office, you know, quick procedure, less downtime, you have to go with PRP or filler. PRP, as you know, is gathered from your own blood. We spin it down so that the cells sink to the bottom, and the plasma, along with the hormones and growth factors from your own body, are in this yellow liquid on top of the test tube. We isolate that liquid, and we can apply it directly onto the skin or inject it directly into this area to help the healing process and to have this area make more collagen and look more youthful and voluminous. Filler in this area is a little bit tricky because you're putting it into an area that lacks volume but also has ligamentous structures. So when you put in filler, there's a couple of fillers that I would probably recommend that you get from your injector, and there are some that I would absolutely not do. I'll start with the ones that you would absolutely not put in here. That's Radiesse, which is your calcium-based filler. You should not put bone into this kind of dynamic ebb and flow area. And the other one that I wouldn't put in is a thicker filler like Juvederm Voluma or Restylane Lift. What you can put in is regular Restylane. Okay, it's called Restylane L, and it's been around the longest among the Restylane family. You can maybe put Volbella, but the other one that I would probably go with is Bellatero. Okay, the Juvederm regular, the one you use for the lips, it draws too much water, and so Juvederm Ultra or Ultra Plus, I definitely would not put in here because you're more likely to get the Tyndall Effect. Okay, so what is the Tyndall Effect? It's a blue hue that occurs right in here when you've put in filler and it lands too superficially. Okay, so it's either between the skin and the muscle, in which case you would really see it, or it's just underneath the muscle but on top of that orbital septum layer. So when your injector puts in filler here, it should be deep. Okay, some of it may be on the bone, some of it may be just between the bone and the overlying tissue, or the SOOF, the suborbicularis fat. Okay, so with that in mind, let's go to the surgical options. Okay, an eyelid surgery is known in medical terms as a blepharoplasty, and for people who generally have fat coming forward with or without this shadow or dark circle, I would generally recommend surgery. Okay, if you have a fat bag coming forward more than your cheek, I would absolutely recommend surgery, because it's very hard to blunt a contour where the hill above it is so big and the hill below it is quite big as well. That would require a lot of filler, and to be honest, it wouldn't look all that good. Okay, so again, some things to keep in mind. Surgery, I recommend for most people over the age of 40 to 45, because unfortunately the process of time and gravity has worked on them a little longer than for patients in their 20s and 30s. Okay, all that being said, if there is a mild amount of fat coming forward, a mild valley here in the orbitomalar, and a substantial volume of cheek, and it's not too thin, your cheek, then your non-surgical options can be good for you. Okay, so for the patient whom I offer lower eyelid surgery, we tend to do this in the office, and we don't have to go to a surgical center. You don't have to go completely to sleep, and you can do this along with other facial procedures. So the patient I'm going to show you later had upper eyelid surgery and lower eyelid surgery all at the same time. Okay, it takes a little more time, but while we're there, we can, do all of the procedures that the patient wants. For every person undergoing surgery, I still recommend a COVID test 3 to 4 days before the surgery, just to make sure that you're COVID negative for your safety and for our staff's safety. I know COVID regulations are constantly changing now that we are starting to go to the beginning of the end of the pandemic, I hope, fingers crossed. But we will err on the side of caution in terms of safety with regard to COVID now, and we always have for the past year. So the other thing to do is to go to your eye doctor, an ophthalmologist, not an optometrist. So the optometrist gets your prescription only, right? So the ophthalmologist assesses your eye health. They would know if you have a retinal detachment, glaucoma, cataracts, things like that, and give you a fair assessment of your visual fields. So, you know, whether there's any eyelid, excess skin, or other tissue blocking your view when you look in any direction. And there's also a test of your tear function. It's called a Schirmer's test, basically assessing how, you know, whether your eyes are dry or not. If your eyes are dry, I probably would warn you that after surgery your eyes might feel a little more dry before it goes away. Okay? When it comes to the surgery, what to do, we generally go through the pink of the eye, called the conjunctiva, okay? And we make an incision through the conjunctiva to get to the fat pockets, okay? This is all after you've had some medicine to make you more comfortable and you have some numbing shots in this area, okay? It might sound a little freakish, but it's very safe. I've done this more than a few times, so I'll walk you through the entire process. If there's any bit of nervousness, I always let you know what I'm doing according to how much you would like to know, okay? For some people, well, for anybody who has excess fat, we remove it through the conjunctiva. But if you have extra crepey skin, we cut away a tiny sliver of skin with an incision that's just under your lash line, okay? And I'll show you another example of somebody I did that for and whose incisions are healing quite well, okay? So the process. Okay, you come to the office, we go over your ophthalmology note, make sure that everything's clear for surgery, and we go over again your goals in terms of what you would like to change. So generally what people would like to change is the forward protrusion of the fat bag under the eyes and the shadow or the dark circle right under it, okay? And so what we do is we go through the conjunctiva, we remove the fat, okay? And then we go through that area to this ligament right here, okay? So this corresponds with the start of your eye socket bone. So we actually cut through the ligament to blur the transition between your eyelid and your cheek. So what that results in is a smooth contour, and there's no demarcation or dark circle anymore, okay? So once we do that, we have a couple of options. If it looks like the fat from the eyelids is going to help mask the transition point, what we can do is we can mobilize the fat and tack it down to here, and you'll have a stitch right over here over a sponge for a week, okay? And that's called a transposition of fat. It means we relocate it from the fat bag eyelid compartment over onto the top of the cheek, okay? For most cases, though, you remove the fat, you throw it away forever, bye-bye, okay? One thing to keep in mind is that between the inner and middle fat compartments, there is a muscle that moves your eyeball called the inferior oblique muscle, okay? And this muscle is important in moving your eyeball. If for some reason it gets shocked or irritated, you might see double for a day, okay? As much as I try to avoid manipulating that muscle, sometimes you have to, sometimes you have to control a little tiny bit of bleeding over that muscle. Okay, it might have a shock and you might see double for a day, but it goes away very, very soon, okay? So this kind of segues into expectations, what to expect during the surgery, okay? Again, I'll explain as much or as little as you would like to know through the process. We protect your eyeball through the whole process, whether it's with our own instrument or whether it's with surgical technique to cover your eyeball so that your iris, your pupil does not get hurt at all, okay? The other thing to note is that because it is surgery, there will be some amount of swelling, and some people the swelling can last days. For some people, the swelling can last 10 days to 14 days. Where you'll notice some swelling sometimes is actually in the white of the eye or just inside along the conjunctiva. This is called chemosis, and it is quite common, especially as you go through the conjunctiva to access the lower eyelid. However, nothing is better for this than steroid eye drops, which we have for you, and that goes back to normal in no time. Okay, so some of the things to do in the recovery process. Okay, we give you some ice packs to go home with, and you can gently put those over the eyes. Okay, your eyes might feel a little more tired, so screen time might be a little bit tougher for you. So relax your eyes, step away from your phone or computer for different segments of time. The other thing is, most people do completely okay with Tylenol or Advil. If you need something more for the pain, we'll give you a few days worth, but overall people do just fine with over-the-counter pain medicine. Okay, you can probably go back to work a week and a half or so later. Again, if you wear frames or glasses, nobody looks past your frames. So glasses are a great thing to wear, regardless of whether they actually have lenses in them. So it's a nice camouflage. Again, there will be some swelling and bruising, okay, a little bit of red, blue, turning into yellow and fading off your cheeks in no time. Okay, so let's go to the before and afters. Okay, this is a lady in her mid-40s. She's actually half Korean. Okay, and so she had a little heaviness to the upper eyelids, as well as you see the dark circles under the lower eyelids. Okay, and if I show you the picture of her looking towards the ceiling, okay, it's accentuated. Okay. All right. So what she wanted to do was actually Asian eyelid surgery, because she's half Korean, and she wanted to improve the appearance under her eyes. Okay. So this is 1 week after surgery. There's going to be a little bit of swelling and bruising. Okay. But for her, I would say it's within the realm of normal. Okay. And if you look here, really the red and the yellow, okay, that's about moderate, okay, and I would expect that to go away in another few days to a week, okay. And along the white of the eye, you see a little bit of swelling. That's the chemosis that can happen, but again, that goes away with time and some steroid eye drops. Okay, so this is her at her most recent visit. Okay, nice and clean. Okay, the transition between the eyelid and the cheek is no more because the orbital malar ligament was cut. So there's a nice smooth transition from the lash line down to the cheek. And you can notice it more when she looks upward. So that's a nice result, I would say. Okay, about 5 to 6 weeks later, she looks this good. And let me show you the before and after of her looking straight ahead. And her looking up. Okay. All right. So if this lady had extra skin, which she does not, the incision would be along the lower lash line, and it would have absorbable stitches, and you wouldn't have to remove any other stitches because, well, they melt away. So through there, you remove a tiny bit of skin, but not too much. And if you want further refinement of the lower eyelid skin crepiness, we can do some laser treatments as well. But I really tend not to remove too much skin because you don't want the eyelid to pull down later on. Okay. This lady had a little bit of extra eyelid skin. She also had previous lower eyelid surgery, but her main issue was the crepey skin and a tiny bit of fat, which we did remove. And here she is 4 months later. Okay. Okay, it's still a little bit of fine lines along the lower eyelids, but again, a nice change. And her mascara hides the scar really well. Even if she didn't have mascara, you would hardly notice. Okay, so that's my spiel on eyelid surgery. Again, please text the word Tyndall to our office number for your chance to win this skincare package. And with that, we'll take questions from the panel.
Okay, a user asked, how long does the surgery take?
The surgery by itself takes, so if it's fat removal only, probably less than an hour from incision to the final closure. If we're talking about transposing the fat, you have to go down a little further along the cheek, and so that probably an hour and a half for both sides. I did forget to mention that the other way to fill in the volume here is with fat. So if there's a severe lack of volume, what you can do is get fat from another part of your body, like your flank or your outer thigh, and you can harvest the fat and process it down to make it like microfat, and then you can put it in an injection cannula and go along this area to fill the volume deficit and blur the transition between the eyelid and the cheek. Now, fat processing, probably adds another hour or so, but overall, if you do that by itself, you're talking an hour at shortest to maybe 2.5 hours if you process fat. This can be performed with other surgeries, so like with Asian upper eyelid surgery, or even a rhinoplasty if you want. So again, this is not a standalone surgery. It can be combined with others as well.
Another user asked, why do we need a eye exam again for surgery?
So this is to make sure that your eye health is good before you have an elective surgery. Okay, if there were something that we did not pick up about your eye health before surgery, and then after surgery we said, oh, there's something wrong with my eyes, then that's why we would want to have a record of your eye health before surgery, and for you to have a relationship with an ophthalmologist, so that if something were to happen, God forbid, okay, that you would have a record of how your eye health was before and how eyelid surgery may have affected that. Okay, thank goodness nobody has had to have that issue yet, and you won't be the first.
One user asked, how much is the surgery?
So for estimates and other things, please talk to our staff. My three lovely ladies, Leah, Corey, and Dree, are all very familiar with the logistics of pricing and other issues, so please talk to them. Let's see, it also depends on whether we remove skin, whether we transpose the fat, things like that. So each individual pricing will be different, so please come to the office for your consultation and talk to my ladies, and they'll be more than happy to help you.
Wonderful. Seems like there's no other questions for today. Can you go over what's in the bag?
Yes, so if you joined us a little later, there's 5 products in the bag. To start, oh, sorry. All right, so to start, there's an exfoliant and this is the toner, sorry. But you start with the exfoliant. The exfoliant will just help, clean any impurities, any gunk from the environment for your skin. And then a toner is a nice product to help degrease and prep your skin for your makeup. For the skincare routine. This is vitamin C and E, a nice antioxidant, and it actually smells like citrus because of the vitamin C. And again, there's no water in here, which means the vitamin C is in its pre-active form. Once it comes in contact with water, whether it's on your skin or other skincare product, it has a nice effect. The next one is vitamin B3 Brightening Serum. So this is niacinamide, which is one of the hot ingredients on the market right now. And it's a nice brightener. Again, it feels good on the skin. And last but not least, your sunscreen. This is Delta MD SPF 46. This is clear, so it's good if you have acne issues or oily skin. And the main ingredient is zinc, so it's a mineral sunscreen. So none of those harmful sunscreen chemicals go into your bloodstream or anything like that. Nala, do you have questions? You're tilting your head as if you have a question.
Oh, Dr. Kim, we also have one last question from a user.
Yeah.
Could a ptosis patient be a good candidate for this?
So ptosis usually deals with the upper eyelid. So upper eyelid droopy, that's ptosis, and that is an issue that I do deal with often, whether it's for Asian eyelids or general upper eyelid surgery. That can be addressed at the same time as lower eyelid surgery. So if that's an issue for you that you would like to discuss, I'd be more than happy to talk about it with you when you come in for the consult. We also do virtual consults. We're having some more out-of-town patients, so we're always available Zoom or FaceTime. Just contact my ladies and they'll be more than happy to help you and schedule that for you. Okay, so again, this skincare bag, gift bag is worth over $300. Please text the word Tyndall, Tyndall, to our office number 703-705-2100 for your chance to win this wonderful gift bag. Thank you all for tuning in. We will see you on the third Friday of June. If there's any topic that you would like to hear about, please text or email the office, and we'd be more than happy to address that for you. Thank you. Have a great weekend.